Hi, this is a tutorial about the skeletal system. The skeletal system supports and protects vital organs, helps out with movement, produces blood cells, and stores minerals that your body needs daily. In adults, 206 bones make up the skeletal system. The skeletal system of a newborn contains about 270 bones. The adult skeletal system is divided into two regions: the axial skeleton, all the labels on the left, and the appendicular skeleton, all the labels on the right. Here we have bone shapes. The skeletal system is made up of four different bone shapes: long bones such as radius or femur, short bones like those in the hands and feet, flat bones like the sternum and scapula, and irregular bones such as the vertebra. Now in this lab we have two types of bone tissue: compact bone and cancellous bone. Another name for cancellous bone is spongy bone. A long bone has two regions: the epiphyses, which are the two ends of the bone, and the diaphysis, which is the middle shaft. The uppermost layer of the bone, which muscles attach, is called periosteum. Deep to the periosteum we have the medullary cavity that contains bone marrow. This bone marrow produces blood cells, stores triglycerides, and other important minerals. Now first we're going to be talking about the axial skeleton. The axial skeleton has subregions which are the skull, the auditory ossicles, the vertebral column, the thoracic cage, and the hyoid bone. The skull shown here has 22 bones. Just to name a few of the facial bones, we have the maxilla, the mandible, also known as the jawbone, and the zygomatic bone, also known as the cheekbone. And in the cranial bone, we have frontal, parietal, occipital, temporal, and sphenoid bone. On the inferior view of the skull, we have a huge hole called the foramen magnum. This hole allows the passage of the spinal cord. The second subregion is the auditory ossicles, which are located in the mid-ear. These bones are the malleus, incus, and the stapes. These vital bones help the whole process of allowing you to hear. The third subregion we mentioned is the vertebral column. The vertebral column has different sized vertebrae, seen on the right, and 5 different sections of vertebra. The most superior section is the cervical, containing 7 vertebrae. Then comes the thoracic, which has 12, and the lumbar with 5. And the last two of the vertebral column are the sacrum and the coccyx. Another name for coccyx is your tailbone. The fourth subregion we mentioned is the thoracic cage. The thoracic cage protects and supports some of the most vital organs in your body, such as your heart. It contains 24 ribs with true and false ribs, costal cartilages, and the sternum. In the sternum, they have 3 main parts: the manubrium, the body of the sternum, and the xiphoid process. The last and final subregion of our axial skeleton is the hyoid bone, which is located in the neck. The axial skeleton make up 80 bones in our body. Now we move on to the appendicular skeleton. The appendicular skeleton also has subregions, which are the pectoral girdle, the upper limbs, pelvic bone, and the lower limbs. The pectoral girdle, shown here, contains the clavicle, also known as your collarbone, and the scapula, also known as your shoulder blade. The second subregion we mentioned is the upper limbs, which contains the humerus, radius, ulna, and the hand. Here we have the humerus, or the upper arm, located on the left. The head of the humerus articulates with the pectoral girdle. The trochlea and the olecranon fossa articulates with the ulna. The radius and ulna bone, located on the right, make up our forearm. The radius is lateral and the ulna is medial. The olecranon process and the trochlea notch of the ulna make up the elbow. Next we have the hand. In the hand we have the carpals, metacarpals, and phalanges. Another name for phalanges is your fingers or digits. Here are the 2 hip bones or pelvic bones. There are 3 fused bones that make up the pelvic bone: the ilium, the ischium, and the pubis. The acetabulum in the 2 hip bones articulate with the head of the femur. Now in females, the angle of the pubic arch is around 100 degrees or greater, and in males, the arch is about 90 degrees or less. The pubic symphysis is one joint that holds the two pelvic bones in place, and during childbirth, this pubic symphysis can separate, which is very painful and can take months to heal. The lower limb is the last subregion of the appendicular skeleton, which contains the femur, tibia, fibula, and the feet. The femur or thigh bone is located on the left. The femur is the heaviest and largest bone in the body. The patella or kneecap helps and protects the articulation between the femur and tibia. The patella sits right on top of the patella surface of the femur. Tibia and fibula is located on the right of the slide. Fibula is lateral, tibia or shin bone is medial. Both the medial and lateral malleolus are the protruding bones in our ankle. The last part of the lower limb is the foot, which contains tarsals, metatarsals, phalanges, and the calcaneus bone. Another name for the calcaneus bone is your heel bone. This concludes the appendicular skeleton, which makes up 126 bones. The skeletal system weighs only about 10 kilograms. It's even harder than steel and miraculously repairs itself when bones are broken. If steel was replaced with all the bones in the body, it would weigh about 400 kilograms. This concludes the tutorial of the skeletal system. Thank you. I hope this helps.